Away. We have a lot going on in the country today, and part of the events that are shaping the news include a meeting that is currently underway. That is the National Assembly Health Committee that is meeting officials of KMPDU and the Union of Nurses to address, among other issues, some of the grievances that have been raised by the healthcare workers. It is currently happening at the KICC. Let's just listen into what is going on.
Because we are in one country, this money comes from one exchequer. These counties don't generate their own money. This money comes from the taxes Kenyans pay. And we urge this parliament to legislate and make laws which enable Treasury to remit this money directly to NHIF without it going through the county governments. If we want to save the public officers, you want to address this problem for once and for all. Because you will force these counties today to remit. Another government who comes on board next time will refuse to remit. We shall be back here again, 5 years, talking about the same thing. And the permanent way of solving some of these things is putting legislation which has that particular solution I've talked about. We have even seen some county governments having received COVID fund from the national government. They are, instead of procuring PPEs for the healthcare workers, they have used this money to build markets. They have used this money to issue bursaries to students. Why are they doing this? For political purposes. Because when they build a market, there are votes there. Markets will be seen. They can tell their voters, this is what I've done. Give me another term in office. If they buy PPEs, I use it in the hospital, nobody can say that. Why are they giving bursaries? They can say in this village, in this ward, I helped this number of households, and therefore you owe me the votes. That is the sad situation. A good example is Nyeri County, and I can't fear to mention. And our recommendation to this committee and parliament carry out audit on the utilization of these funds that they were sent to counties. The counties are busy playing PR in media, showing how they have equipped and created isolation centers. Yet they are showing you beds of regular medical conditions, not beds for COVID-19 isolation. But you see in the media, they spread the bed sheets on the beds, they take photos, you say, wow, this county is well prepared. This pathetic no county as of today has the 300 bed capacity of isolation for COVID patients. That is the reality of the matter. What can be done, a question which came up, can be due in 2012-2013, together with the Minister of Health, came up with what we call the Musimi Task Force report, which stipulated on the requirements per level of hospital, per level of health facility that is required to make it operational, from level 1 up to level 6. And they gave list of equipment, staffing, and any other necessary supportive infrastructure that needs to be done. And they proposed a first budgetary allocation for these things to be achieved. We're in 2020. That report.
All right, submissions there by the KMPDU officials on a day when they are appearing before the National Assembly Health Committee to discuss several issues that include their welfare of the healthcare workers in the country and also the efforts that have been put in place in the mitigation of COVID-19 in the country on a day when so far we have recorded past 70,000 cases of COVID-19 and over 1,300 deaths. Of course, we'll be following up up on this particular sitting to see whether there could be any issue that could come forth that can be a very good milestone in the war against COVID-19.